everyone, it's Archana.
And Dara.
And you're listening to the Daily Dose of Salt. In today's episode, There's No I in Mass Food Changes, we'll be discussing the global health interventions targeted at decreasing the prevalence of iodine deficiency all around the world.
We'll be looking into the health intervention that took place in Australia to combat iodine deficiency among pregnant women and children. This case study got us thinking about the ethical dilemma of altering food during mass food production and its long-standing impacts on malnutrition as a whole.
Yep, so before we dive into the details of the intervention and later the discussion, we'd like to take a moment to introduce our very special guest for the day, Dr. Kathleen Gorman. Dr. Gorman received her PhD from the University of Maryland and is currently a psychology professor at the University of Rhode Island. She has spent 3 decades researching infant and child development, as well as malnutrition and behavior and risk and resilience in the context of poverty. So without further ado, please give a warm welcome to Dr. Kathleen Gorman.
Thank you very much for having me. I'm excited to be here back with my fellow Aggies, I guess, back at Maryland after more than 30 years, but I'm happy to be here. And I have been doing a lot of research, and part of that research on malnutrition has dealt with iodine deficiency in China. So I'm looking forward to the discussion.
Thank you so much for being here. We really appreciate your time, and we're interested to hear your perspective on the topic.
Yeah, absolutely. So before we kind of get into the case study that we're going to be focusing on, we'd like to introduce the health problem so that you're all aware and know its context in Australia specifically. So iodine deficiency is defined by the American Thyroid Association as the body's inadequate intake of iodine, which is a very important element that's needed for thyroid hormone production. And the topic of iodine deficiency is often overlooked in public health, but it's very important, and it leads to a variety of adverse health consequences if it's not considered. According to the WHO, iodine deficiency can lead to impaired cognitive and motor development in children, and they also state that iodine deficiency during pregnancy not only results in brain damage to the fetus, but also low birth weight, prematurity, and increased perinatal and infant mortality. The Australian Thyroid Foundation states that more than 50% of children and pregnant or breastfeeding women living in Australia have been shown to be iodine deficient and are at the risk of developing thyroid disease. And a 2007 report on the prevalence and severity of iodine deficiency in Australia, which is where this case study was conducted, includes that iodine requirements increase substantially during pregnancy and lactation, which makes pregnant and lactating women and their babies very high-risk groups for iodine deficiency. So all of these studies of iodine status on pregnant women conducted over the past 10 years in Australia consistently suggest that iodine intake is inadequate as a whole. So it's very important to highlight that iodine deficiency is easily preventable at a low cost, which is very rare with global health issues, but its prevalence still has yet to be fully addressed.
And with that, we can get into today's case study. So this specific case study that we'll be referring to throughout the podcast was a mandatory iodine defortification program conducted in Australia in 2009. In order to combat the difficulty of consuming enough iodine from natural sources alone, this intervention aimed to add iodine into everyday foods in order to ensure that the general population was meeting the necessary iodine requirements for their bodies. So in this case study, bread was chosen to be fortified with iodine, as most people consume it on a regular basis. And through the fortification of iodized salt in bread, this study aimed not only to increase iodine intake, but also determine the factors influencing iodine intake among different parts of the population. So after this intervention was conducted, researchers assessed how this intervention affected the amount of iodine consumed in high-risk groups, such as pregnant women.
Yeah, and the results of this intervention were definitely very interesting. They found that after they were collected, so after 2 years after the fortification program was introduced, the results were collected, and they found that adolescents as a whole had approximately the appropriate amount of iodine intake after the program was implemented. However, they found that children aged 2 to 18 years old, 8.1% of this demographic still had inadequate iodine intakes, which is a relatively smaller percentage, but if you're looking at the population as a whole, whole, it's still a large number of people. And for women of childbearing age and children, those who consumed 100 grams or more of fortified bread per day, which is about 4 slices of bread, they were more likely to have adequate iodine intake than those who didn't consume that much or consumed less. As far as the confounding factors go, this study found minor associations with age, socioeconomic status, and geographic remoteness area. So the differences and correlations were not as high as they expected, but they were still definitely there. And in all, this fortification program was very successful in increasing iodine intake across all socioeconomic groups and geographical regions as well. So one interesting point about the case study was that they indicated that moving forward, it's recommended that there should be increased surveillance and monitoring of Australian women and children's iodine statuses specifically, as these groups were not consuming bread at the level of other demographics, which is definitely a very interesting point to consider.
Absolutely. So now knowing what the case study is about and its various components, it begs the question, is altering food at the mass level the best solution to combat the issue of iodine deficiency and malnutrition? In addition to that, what kinds of implications, whether they be ethical, moral, or legal, does it bring upon the targeted population? So as we move forward in today's episode, we want to keep in mind these central topics regarding the intervention.
Yep. So now we'll kind of get into the bulk of tonight's discussion, and joining us, we have some college student spectators on the call. So if you have anything to add to the discussion, feel free to jump into the discussion as you please. And as we mentioned earlier, we have the lovely Dr. Gorman here to share her expertise as well. So I guess we'll kind of jump in and kickstart the discussion. What were some aspects that you all found this intervention conducted successfully or did consider well? I found that they did consider the different demographics when evaluating the study. They did consider age and socioeconomic status, which I feel like is very important in ensuring that the results are representative of the different groups of people in the population.
I agree. And also, I want to chime in. I think that they chose a good food item to fortify with iodine because it's widely available, it's relatively cheap, and most people consume it on a daily basis.
Yeah. And regarding the socioeconomic status, I do have a question for you, Dr. Gorman. So how does the socioeconomic status of different populations or groups affect their access to iodized foods?
Socioeconomic status and iodine deficiency is really interesting because in contrast to most conditions of malnutrition that are very much confounded with socioeconomic status, it had originally been thought that because iodine is a naturally occurring in the soil, that it would not discriminate based on socioeconomic status, and it would just be based on geographic where you lived. But it turns out that some of those geographic determinants are also related to socioeconomic status. And then since countries have started to do things like interventions or fortification or iodization of foods, we're now seeing more disparities in terms of socioeconomic status, as this study showed, so that lower income households were still eating less of certain foods.
Yeah, and as Doris mentioned earlier, they did use bread as their source of fortifying food. And I would consider bread to be a pretty staple food in many households. So is it true that bread is widely accessible in different countries? And is it a good choice for fortification program? Or are there like other foods that are more appropriate or more accessible alternative to increasing iodine intake?
One of the curious things about this was they used iodized salt in the bread. And where iodization has been most successful is just with iodine. And so I would say that one of the limitations about this study was that they didn't measure iodized salt intake. So it appears that they underestimated by quite a lot the degree to which people were actually consuming iodine. And alternatively, when they originally came up with the recommendations, based on what I read at least, when they came up with the recommendations of how much iodine to put in the bread, they overestimated substantially the amount of bread that people eat. And so most of the people that they surveyed were not actually eating the amount of bread that they had hoped would be eaten. I think the other problem is for many reasons, I think eating a lot of bread is no longer considered particularly healthy. So the fact that people are eating less bread than they were 10 years ago may in fact be a health determinant. I'm not really sure. I'm not familiar with the cultural food choices in Australia. However, I think focusing on more basic foods like salt probably make more sense.
Yeah, definitely.
I kind of found it interesting how they chose to iodize the salt and then put it into the bread rather than just distributing the iodized salt alone as well.
Yeah, I feel like that also kind of is a management or like a decision that they have to make at that kind of government level, because they are spending more money running it through iodized salt and then putting the iodized salt into bread, which I feel like might be an unnecessary step, might kind of spend a lot of time and resources that don't necessarily need to be spent. So I feel like that's also a conversation to have, as well as like, is the government doing everything they can do to make this process the most efficient and most I guess the most likely to increase the iodine intake within the population. Yeah, I also felt that as far as things that I felt like the intervention could have done better, I know that the levels of iodine intake aren't the same for everyone in the population. So I think they definitely needed methods to ensure that this doesn't lead to overconsumption in iodine, because that's definitely an issue as well. I feel like if giving every household the same amount of increased iodine bread, I feel like that might not have been the best way to approach it, especially for groups that are more susceptible to overconsumption of iodine. So I guess my question is, like, how life-threatening is this if it does lead to overconsumption? How bad can this issue get, iodine deficiency? And does it reach a point where it's not necessarily life-threatening if it does happen to be overconsumed, or kind of along those lines?
So those are interesting questions. I think that overconsumption of iodine is very, or like toxicity from iodine is extremely rare. Iodine isn't stored in the body, so it's constantly being expelled. And so what I've read, at least my understanding is you would have to consume a phenomenal amount of iodine to experience toxicity. And so it's relatively rare. So I think that's probably not a huge concern, although it's always something you want to track and monitor and make sure that you're not doing that. I think the other limitation of the study, although I thought the study was very interesting, was they didn't measure iodine, they didn't measure THS levels or urinary iodine, they just did dietary intakes. So they were measuring iodine based on diet, which is fairly limited. And again, as they said, they didn't include salt intake in part of their assessment. So I think that it would be hard there's lots of interesting ideas to pursue from the study, but you would not want to make policy based on the study, I think, because they weren't really measuring iodine adequacy in the individuals that they were studying. They were just kind of extrapolating from their diets to what degree they had consumed iodine.
Yeah, definitely. I feel like that when it becomes a policy issue, that kind of opens the doors to like lawsuits potentially for people who feel that like this decision wasn't in the best interest of the people, and it becomes a threat, and also like potentially protests if people find that altering food at the mass food level could be very very risky for some people and very hard for some people to understand or comprehend. So I feel like that's definitely policy related consequences, could be like lawsuits or protests or something in the future too.
Yeah, and just piggybacking off of what Archana just said, I feel like there could be several moral conflicts people have over the artificial modification of their food. It could go against their religious or personal beliefs. So they need to consider options that account for everyone's iodine intake. And so my question kind of is, what barriers or backlash are being seen from artificially altering food to include iodine?
I guess I'd take that in two parts. The first part is iodine is a naturally occurring substance, so I'm not sure that it's altering. I guess I'd have to think about whether it's actually altering. It's just adding a food substance that already exists. So if you live in a particular area where there's iodine in the soil, your vegetables automatically just have adequate iodine. I think going back to the previous comment, the danger and risk of severe iodine deficiency far outweighs anything else. It causes mongoloidism, cretinism, deafness, gait problems, mental retardation. It is extraordinarily severe. So what you want to make sure is that you've eliminated all possibility of severe iodine deficiency. And then you have to do, I think you do have to do a cost benefit analysis of what is the best way to assure that everyone is getting adequate iodine. And while I do not want to hold up the US as a model, we had iodine deficiency in this country and we eradicated it through iodized salt. And now no one thinks twice about the salt that we eat, except that they tell us now we eat too much salt. So we have to, cut out salt in our diets. But, and other countries have done similar things. So I think it can be done. I'm not sure. I read somewhere where Australia recommends iodized salt, but doesn't require it. So like a certain percentage of all commercial foods use iodized salt, but another percent don't. And households, apparently about half of them, or maybe less than half, use iodized salt and the other half don't. And so I'm not sure if that's a cultural, I think you would want to look into the cultural beliefs around that, or whether it's a cost issue or what it is about why it hasn't become more normalized in the sense of more common. I think in other countries they've used sugar, and that has been met with a lot of resistance because it changes the color and a little bit of the taste. And so that was not successful in other countries, in some countries. So I do think you have to look at all of those things. And again, I don't want to say that there's no risk involved. I think you do want to look at that. I'm less familiar, at least what I've read suggests that the risk is minimal. But you do want to always make sure that whatever you're promoting is culturally acceptable to the population, right?
Yes, definitely. I think even considering the cultural beliefs, I think it's also important to consider that this intervention requires the help of the community as well. So I feel like it doesn't work when it's necessarily like a third party coming in and changing things about the population at hand. I feel like it's very much has to come within the community itself, and there has to be a communal understanding of the importance of iodine and how to go about fixing it. And once that understanding is achieved, I feel like that's where the best results from the intervention come. I'm curious, do you think this is an issue that requires help from maybe more developed countries? I know Australia is a developed country, but for countries around the world that are lesser developed, is this something that requires outside intervention, or can this be a problem? Can this be something that can be solved within the community itself?
I don't know the answer to that. I think countries have to make their own decisions. I think what's interesting about this study is that they're not talking about severe iodine deficiency. They're talking about mild levels of iodine deficiency. And the research is still not clear the degree to which mild iodine deficiency in pregnant women affects their children's outcomes. And that's because it's a really hard, the study that I did 20 years ago was was trying to get an answer to that question. And it's a really hard question to answer because of methodology and working with pregnant women and, whether you supplement them or not, it's challenging. And so there's some correlational data that says that there may be effects of mild levels of iodine deficiency that impact children's cognitive development, in which case we have to continue to address it. I think it's not a popular topic. And so I don't think a lot of people except the small research groups that study it, I don't think it's very well known. I don't think many people study it, which is why I was excited to hear you guys had chosen it. It isn't a somewhat, I don't know if it's esoteric, it's just people think it's been taken care of and they don't have to worry about it anymore. And I think that's probably, so I think it does probably require considerable, I think there's some really strong research groups in Great Britain, in Australia, in China, a couple other places that continue to look at this, and Italy, that are doing good work on trying to pursue it. So I think it can happen. It's not as topical or popular as some of the other nutritional deficiencies that have been much better studied.
Yeah, I actually, going back to what you just mentioned, I think I'm definitely a victim of that too, because I remember researching about this topic and finding out that over 50% of women and children in Australia were iodine deficient was very surprising to me, because I would have never thought that that was such a prevalent issue. Just if someone asked me, like, where is iodine deficiency most prevalent, I would have never assumed Australia, just because, and that, I think that kind of goes to show how this issue kind of just like is low on the radar. It's very much like people don't really think about it, and it's very much covered. But I feel like that makes it all the more important to continue like talking about it and finding solutions to approach it. But yeah. Yes. So yeah, considering all that information, that was really great. Where can we kind of go from here, and what do you believe is the best way to combat iodine deficiency around the world?
I don't know. I think you all should continue to pursue these topics. It's fascinating, the work that you're doing, and you're learning so much. I love that you're doing it. Maybe you'll become nutritional researchers in your future lives. I do think that things like iodized salt, or taking a product that everyone eats and figuring out a way to put iodine into that product, I think it can be done safely. That I feel very confident that it can be done safely, and that it's the most efficient and the least costly way to do it. Having said that, clearly, and you guys have brought this up, respecting the cultural norms of each society, but it can be done, and I think those would be the most effective ways to go about it, because then you're not trying to give everybody a prescription anytime they get pregnant, and trying to make sure that, like monitoring it so hard. That's such a hard thing to do, and it costs a lot of money, and that's when people kind of resist that. But if it's just, our bread is all fortified with vitamins and minerals, and nobody thinks twice about it. And that's probably why they did it in Australia. I'm thinking now that I said that, but there can be easy ways to do it. And I think that, there's international organizations that focus on this, and that they continue to make efforts to make sure that all societies have adequate iodine.
So in addition to, international groups that are working towards eradicating iodine deficiencies, how can we elicit a sense of urgency in Americans who have never had to worry about iodine deficiency to find and care about solutions towards decreasing the prevalence of iodine deficiency in other places around the world?
The United States is always a leader, or thinks they're a leader, or tries to be a leader, depending on what issue it is. And, we pulled out of the World Health Organization. Now we're back into the World Health Organization. I do think international organizations have a role to play. And I think that through that, those international organizations, people in the United States can support efforts. I mean, we don't want the United States going into these other countries telling them what they need to eat. However, we can support through our policies and through our financial means, efforts for these international organizations to make sure that that everyone has enough to eat, and the right foods and healthy foods. Iodine deficiency is one of many, many concerns around malnutrition that I think we need to pay attention to.
Definitely. I think a big part of it is continuing this conversation and keeping this topic alive, and not letting it kind of fall at the back burner. I think that's definitely a big part of making everyone in the world aware about this issue, and also like especially Americans, considering that we haven't had to really worry about it. But yeah, definitely. I think that kind of wraps up our time for the evening. We just want to say thank you so much for joining us today. And thank you for our college spectators listening on this call. We really do hope that you all learned something from this podcast and were able to take something away from it. And we hope that this kind of encourages you all to keep this conversation going further. So thank you so much, Dr. Gorman. Thank you, everyone. And we will catch you on the next episode of the Daily Dose of Salt. Bye-bye.
Bye, guys.